Hello, welcome, and thank you for joining Help Us Help You COVID-19 Social Health Impact Assessment Results webinar. Northeast Delta Human Services Authority is led by Dr. Montez A. Sizer, Executive Director. Collectively, we are all directed by our vision, mission, and tenets. Our vision: to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Our mission: to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders. And our tenets that guide our actions: greater access to services, excellent customer service, and quality, competent care. Again, welcome to Help Us Help You COVID-19 Social Health Impact Assessment Results webinar with Dr. Jeannie McGee, Director of Behavioral and Primary Health Analytics.
Thank you, Alan, and thank you everyone for joining us this afternoon. I'm Dr. Jeannie McGee, Director of Behavioral and Primary Health Analytics at Northeast Delta Human Services Authority in Monroe, Louisiana. I joined Northeast Delta in January of 2019, and I'm very proud to be part of such a wonderful agency. I have a bachelor's degree in psychology, a master's in health sciences, and a doctorate in health education and research. I have over 20 years experience in clinical research and patient outcomes, and around 17 years in biostatistics as both a director and a medical educator. Northeast Delta is a progressive agency continuing to strive for excellence through innovation. The addition of the analytics department is a testament to Dr. Sizer's vision for the agency and the people of Northeast Louisiana. Today's webinar is the first of many planned to share important agency data with the public. The goal of today's webinar is to provide information and offer insight into the social health impacts of COVID-19 on the clients we serve here in Region 8. As some of you may know, the COVID-19 Social Health Impact Assessment was made available to the public for completion in the early summer months. This edition of public assessment allowed us to expand to people throughout the region, state, and beyond who may not currently be taking advantage of our agency services. Assessing the needs of others is important, as we can use that information in program and service planning in order to reach larger or different groups of people. This preliminary data analysis conducted on the Social Health Impact Assessment was performed on data collected from our agency clients only, so that we could identify and address any immediate needs of the clients we serve at this time. So the results presented here today represent only the agency clinic data. Today's objectives are to learn about the clients we serve, describe the purpose and methodology of the Northeast Delta COVID-19 Social Health Impact Assessment, and to review the assessment results. First, I want to tell you a little bit about who we are and what we do here at Northeast Delta. Northeast Delta serves clients throughout 12 parishes in Northeast Louisiana, which make up Region 8 of our state. Our client population includes individuals with mental and behavioral disorders, addiction and substance use disorders, and developmental disabilities. Our services and programs were developed to address the specific needs of our client population and the unique issues they face. By taking these things into consideration, we use a holistic approach in every possible way by providing not only mental and behavioral health services and treatments at our 6 outpatient clinics across the region, but by also offering several other things to our clients. Through our integrated healthcare services, we also screen and address basic primary health issues. We maintain a very active community presence through our Prevention and Wellness Department, and we have peer support and case managers available to all of our clients. We also have long-running collaborative relationships with several organizations and health facilities, and have developed a strong network of partnerships throughout this region. What really sets us apart, though, is our focus on social determinants of health. Social determinants of health are all of those things that are specific and unique to people that influence their health and wellness, but they're most often not addressed or even assessed when seeking treatment and services from most health agencies or facilities. This includes things like a person's living situation and their environment, social economic status, their employment, education, support system, and even things like transportation and how this might affect their access to health care. You may have heard these referred to as health or social disparities. These are the foundation of program development at Northeast Delta because we understand that treatments won't be effective no matter how good they are if the basic needs of people are not being met and they aren't considered in treatment planning. This summary of client and services data shows the number of clients who received services and participated in some of our programs in fiscal year 2019. In addition to our outpatient clinic developmental disability services, we provide housing services to 124 clients and workforce and employment-related services to over 160 clients throughout 3 different programs. Housing and employment are a couple of the social determinants that we help address. We also served close to 3,000 clients through our inpatient and residential addiction programs. Through our outpatient mental and behavioral health clinics, we provided over 20,000 services to more than 2,000 individual clients. These clients had various diagnoses, as you can see, and the majority of them, around 35%, were diagnosed with depressive disorders, followed by schizophrenia spectrum and psychotic disorders. Over 30% of our clients were between the ages of 36 and 50. Close to 10% were age 61 and up. Overall, around 75% of our clients were between the ages of 26 and 60. Over 52% were female, and around 47% were male. This gives you a general overview of the clients we see on a regular basis through our outpatient clinics, which was the source of the majority of the data from our COVID-19 social health impact assessment with agency clients. So now we'll move on to the assessment. The purpose of the COVID-19 social health impact assessment was to determine how the COVID-19 pandemic is affecting our agency clients. When Louisiana Governor Edwards issued a stay-at-home order in March of this year, our executive director acted quickly to transition agency client appointments from on-site to telehealth visits only. We knew that this transition would be difficult for our clients, but we also knew that all the other changes taking place in our clients' lives due to COVID would be difficult as well. So we felt like it was very important to hear directly from our client population about all the things that were most concerning to them and challenging for them. This new way of life the entire nation was experiencing was difficult, but it was really more difficult even so for people who are already living with disorders and conditions that can make daily life more challenging. Because there was a stay-at-home mandate, assessments were completed over the phone or through Google Documents by our agency staff. Current active agency clients were given the opportunity to complete the voluntary assessment during their regular scheduled appointment, and some clients were contacted specifically for the opportunity to complete it if they weren't scheduled for an upcoming appointment in the near future. Assessments for clients who were not age 18 or over, as well as those who were unable to complete the assessment without assistance due to cognitive impairment, were completed by a parent or legal guardian on their behalf. The COVID-19 Social Health Impact Assessment collected basic demographic data such as age, gender, race, relationship status, living situation, housing composition, and employment information. It also included 30 items that assessed client concerns about finances, food security, health, and relationships, as well as COVID-19 related personal well-being, mental and behavioral health status, and then a couple of general items pertaining to information access and practices. Data from the assessment was analyzed using SPSS software version 26 using appropriate non-parametric statistical tests. All significance levels were set at 0.05. This presentation highlights several of the statistically significant findings, but it does not include all the data results or the specific test result values. All of this information can be found in the full comprehensive data analysis report that's available on our website. We'll start the review of results with the demographic data. A total of 530 agency clients were contacted, and 88% completed the assessment. This gave us a total sample size of 467. These 467 clients were primarily clients of our outpatient mental and behavioral clinics, and we had around 8.5% completed through our developmental disabilities department. The average age was 46.7 years, and client respondent age ranged from 3 years to 85 years. Over a quarter were between the ages of 36 and 50, making this the largest age group in the sample, which is an accurate reflection of our client population. 54% were female, 45.6% were male, and 2 were transgender. Nearly 59% of the client respondents were African American, and around 40% were Caucasian. While the majority reported being single, living alone in their own home, we did have a high percentage of clients who were living with friends or relatives. Over 7% of our clients were single with children. We also had 2 clients report that they were homeless at the time of the assessment, and a little under 2% were living in residential or group homes. A large portion, around 69% of our clients, had not been working prior to COVID-19, which is not uncommon for our client population, since they're in active treatment or seeking services for their diagnosed disorders. And for those who were working prior to COVID-19, which was about 1 in 3, many were no longer working due to the pandemic, so only about 1 in 5 was working at the time of assessment. Around 1 in 11 agency clients reported that they had experienced some type of employment change due to COVID. While some previously employed clients became unemployed, there were significant differences in employment among clients who had been working part-time, as many started working full-time once the pandemic began. This was the case among clients working in the healthcare field, business and professional services, and food service field. Clients working in business and professional services experienced the most changes in work location, with many of them moving from working outside of the home to working at home. We're now going to take a look at some of the resource concerns reported by our clients. We assessed client concerns about resources typically common among social determinants of health that can significantly impact daily living and functioning, including finances, food security, healthcare access, and social interactions. The top 5 concerns reported by our clients were having a loved one get COVID, getting COVID-19 themselves, having enough income or money to pay household bills, unknowingly giving someone COVID because they're asymptomatic, and being unable to visit relatives or friends for social interaction. Percentages presented here represent only those clients who ranked the concerns as a 5, which meant most concerning. As you can see, 3 of these top 5 concerns were health and healthcare concerns. 1 was a household financial concern, and 1 was a social and relationship concern. This indicates as a whole that although our clients were faced with employment changes and financial worries, Their primary concern was the health of their loved ones first and their own health second. This bar graph shows all the assessed resource concerns in the order of concern as identified by our clients. Again, percentages presented here represent only those clients who ranked the concern as a 5, which was most concerning. You can see here, after the first 5 primary concerns we just pointed out, the next most concerning things identified by our clients was being unable to attend in-person church or religious services. This concern ranked higher than some of the financial and food security concerns too. For the next few slides, we're going to look at concerns that clients ranked either a 4 or a 5 on a scale from 1 to 5, which represented more than just an average concern. So these findings reflect moderate to significant concerns when the 2 highest ratings on the scale are combined. Overall, about 25% of our clients were concerned about having enough income or money to pay their household bills. We found that changes in employment affected client response to this assessment concerns. Clients who had experienced employment changes during the pandemic were significantly more concerned about having enough money to pay their bills. Clients who were unemployed but looking for work were more concerned than unemployed clients who were not actively looking for work at the time. Around 20% of our clients were concerned about having enough money to buy food to make it through the pandemic. Again, clients who experienced employment changes during the pandemic were significantly more concerned about having enough money to buy food. There were also some significant differences in responses based on the location of the outpatient clinic where our clients are typically seen. Clients from our Tallulah clinic expressed the most concern, while clients from our Monroe and Ruston clinics reported the least concern about having enough money to buy enough food to make it through the pandemic. We also found that clients who had children, regardless of their marital status, were significantly more concerned about having enough money to buy food. The concern of having enough money to buy food to make it through the pandemic was reported by over 26% of single clients with children and 20% of our married clients with children. There were no gender or race differences here. Healthcare access and health-related concerns were also assessed. More than 25% of our clients were concerned about being able to seek medical attention if needed. Clients who experienced employment changes during the pandemic were significantly more concerned about being able to seek medical attention than clients with no employment changes. Over 15% of our clients were concerned about having enough medicine or health supplies. There were some clinic location differences here as well. Clients from our Tallulah and Bastrop clinics were significantly more concerned about having enough medicine or health supplies to make it through the pandemic than clients from any of our other clinics. Because social interactions and personal relationships are critical to individual well-being and mental health, we assessed client concerns about these interactions being limited during the pandemic. Over 26% of our clients were concerned about being unable to visit relatives or friends for social interaction. Around 18% were concerned about being unable to care for family who need attention or care outside of their home. And over 21% expressed concerns about being unable to attend in-person church or religious services. There were significant differences between employment groups again, with clients who experienced employment changes during the pandemic significantly more concerned than clients who did not about being able to visit their friends and relatives and being unable to care for family. Also, unemployed clients not looking for work were significantly less concerned about visiting relatives and friends or being unable to care for family than the unemployed clients who were actively looking for work. Additionally, female clients were significantly more concerned about being unable to attend church services than male clients. Over 14% of our agency clients reported experiencing stressed or strained relationships while having to stay home. There were several things that were associated with client reports of stress and strained relationships. All of these were positive correlations, and this means that as concerns about these issues went up, client reports of stressed relationships went up as well. Some of these things included being unable to care for family, being unable to visit relatives and friends, being unable to attend church services, unknowingly giving someone COVID-19, and client concerns about having enough money to pay bills or buy food, having enough medicine or health supplies, and client concerns about being able to seek medical attention if needed. Also, there was a significant difference in reports of stressed and strained relationships between parents who were having to assist their children with schoolwork and those who were not. Parents having to assist children with schoolwork reported experiencing stressed and strained relationships more frequently. In addition to these relationships, there were also significant differences between reported stressed relationships and client age groups, with our youngest client, age 0 to 17, reporting this most frequently. 43.8% of these clients in this age group reported feeling stressed and strained relationships. The association between stressed relationships and client age was an inverse or negative correlation. This means that the reports of stressed or strained relationships went down as client age went up. So younger clients reported stressed relationships more and older clients reported them less. There were statistically significant positive correlations for other measures of social and relationship concerns also. A positive correlation means that as reports of one concern went up, reports for the second concern went up as well. These positive correlations were found between client concerns of having a loved one get COVID and being unable to care for family, concerns about getting COVID and unknowingly giving it to someone else, unknowingly giving someone COVID and having a loved one get COVID, and getting COVID-19 and having a loved one get COVID. Again, when age was considered, the relationship was inverse. So all of these concerns were lower as client age was higher, telling us that these concerns decreased with age. To assess the effects of the COVID-19 pandemic on personal well-being, we used a Likert scale to ask clients to rate their agreement with 6 statements, from strongly disagree to strongly agree. The first 3 personal well-being items involve the client's personal feelings and how these may or may not have changed since the pandemic began. Findings of these assessment items showed that 32% of our clients experienced more nervousness or anxiety. Nearly 24% experienced more loneliness, sadness, or depression. And over 21% experienced more frustration, irritability, or anger. There were many factors that affected our clients' ratings of these specific feelings. We'll look at which things affected reports of nervousness or anxiety first. There were significant differences among client age groups in reported nervousness or anxiety. Clients aged 18 to 25 years reported experiencing more nervousness or anxiety more frequently than any other age group, with 51.7% of clients respondents in this age group reporting these increases. Clients aged 61 and up reported this less than any other age group. And again, there was an overall inverse correlation with age. so nervousness or anxiety decreased as age increased. Single clients with children reported experiencing nervousness or anxiety significantly more often than clients in any other household or living situation. Other groups that reported these feelings more frequently included unemployed clients who were looking for work and clients who did not have access to local TV channels at home. There were also several assessment items that were significantly correlated with experiencing nervousness or anxiety, including financial and health concerns. Some of these were client concerns about having enough money to pay bills or buy food, concerns about a loved one or household member getting COVID-19, unknowingly giving someone COVID-19, concerns about having enough medicine or health supplies, and concerns about being able to seek medical attention if needed. All of these were positive correlations, so the more concerned clients were about these things, the more nervousness or anxiety they reported too. For feelings of loneliness, sadness, or depression, clients aged 36 to 50 reported experiencing more of these feelings since the pandemic began than any other age group. But as you can see, there was less variation in percentages among the groups. And here, our youngest clients reported these feelings the least. Again, there was a significant inverse relationship between these feelings and client age, with reports of loneliness, sadness, or depression decreasing as client age increased. Unemployed clients reported these feelings significantly more than employed clients, with clients who had been laid off reporting the feelings of sadness, loneliness, or depression the most often. Clients without access to local TV channels also reported these feelings more frequently than clients who did have local channel access. And finally, clients concerned about money, food, and health resources were significantly correlated with client reports of loneliness, sadness, or depression. Again, each of these associations were positive correlations. So clients reporting more concern about these things also reported more feelings of loneliness, sadness, or depression. This means that reports of these feelings were more common in clients who also reported concerns about having enough money to pay bills or buy food, concerns about loved ones or household members getting COVID, unknowingly giving someone COVID, having concerns with enough medicine and health supplies to make it through the pandemic, and concerns about being able to seek medical attention if needed. While our youngest clients reported feelings of loneliness, sadness, or depression less than the other age groups, they reported experiencing increased frustration, irritability, or anger more than all other ages, with over 37% reporting these increased feelings. Again, there was a significant inverse relationship, or what we call a negative correlation, with age group. So reports of these feelings decreased as client age increased. Single clients with children reported feelings of frustration, irritability, or anger significantly more than any other household composition. Unemployed clients who were actively looking for work reported these feelings more frequently than unemployed clients not seeking employment. There were also significant positive correlations between feelings of frustration, irritability, or anger, and client concerns about money, food, and health issues. Interestingly, clients who had internet access in their home reported frustration, irritability, or anger significantly more often than clients without internet access. Also, clients without local TV channels reported these feelings more often than clients who did have these channels. The other three personal well-being assessment items focused on how clients used their mandated time at home during the pandemic. Over 40% of our clients reported using this time spending more time on self-care, and over 40% also reported using the time to enjoy nature and the world around them. 34% reported using the time to build stronger personal relationships. There were significant differences between clients' living situations and reports of how they used their mandated time at home. As you might expect, single clients living alone reported using the time to build stronger relationships much less than any other group. But it was interesting to see that single clients with children at home spent more time on self-care than single clients without children. And married clients with children at home also spent more time on self-care than single clients with no children. Also, as the number of household members increased, reports of spending time to build stronger relationships increased. Next, we're going to see how clients reported their mental and behavioral health status was affected by the COVID-19 pandemic. Overall, about 1 in 6 clients reported feeling a mental health status decline since the pandemic began. About 1 in 7 clients reported struggling more with their problems since COVID-19 began. And 10% of agency clients reported feeling a sense of doom and like things will only get worse. Just as we saw with client reports of personal well-being, there were several factors that affected client reports of mental and behavioral health status changes. As noted in reports of nervousness and anxiety, clients aged 18 to 25 years reported feeling a mental health status decline more frequently than any other age group, and this difference was statistically significant. Also, once again, clients aged 61 and up reported mental health status decline the least. There was a significant inverse relationship here as well, as reported mental health status decline decreased as client age increased, so older clients seemed to be less negatively affected in this way. Clients from our resting clinic reported mental health declines significantly less often than clients from any other clinic. Also, clients working outside of the home reported mental health status declines significantly more frequently than clients who were working from home. Client reports of mental health status decline were positively correlated with concerns about money, food, health, and being unable to visit and care for family members. So again here, the more concerned clients were about money and health issues, the more mental health declines they reported. There were also significant positive correlations between the client reports of mental health decline and experiencing stressed relationships, and all 3 measures of personal well-being, including nervousness or anxiety, loneliness, sadness or depression, and frustration, irritability, or anger. This tells us that clients who reported experiencing stressed relationships more also reported mental health status declines more. They also reported mental health declines more often if they had also reported nervousness or anxiety, loneliness, sadness, or depression, or frustration, irritability, or anger. Many of the same factors were found to affect client reports of struggling more with their problems. This same age group, ages 18 to 25, reported struggling with their problems more since COVID-19 began, just as they reported more nervousness or anxiety and more mental health status decline. And again, clients age 61 and up reported struggling with their problems significantly less than any other age group. One of the things that makes these findings so interesting is that during the time of our social health impact assessment, the age group reported to be most susceptible and at risk by COVID-19 was the oldest group of our clients, and yet they reported significantly less effects on their personal well-being and mental health than any other age group in our client sample. Interestingly, clients working from home reported struggling with problems significantly more than clients who were working outside of the home. The same client concerns and personal well-being measures as noted with mental health status decline were also significantly correlated with reports of struggling with problems. The same financial, food, and health concerns were also associated with the client reports of struggling with their problems. Finally, for client reports of feeling a sense of doom and like things will only get worse, nearly 19% of our youngest clients reported these feelings, which represented the highest percentage among age groups. Client concerns about money, food, health, and all three measures of personal well-being were also significantly correlated with this assessment item, just as they were with reports of mental health decline and struggling more with problems. For most assessment items of personal well-being and mental and behavioral health status, we found that the negative effects of COVID-19 seemed to decrease as client age increased. In addition to client age group, some of the other significant effects on our clients' reports of personal well-being and mental behavioral health were clinic location or agency department. Clients who were assessed through our developmental disabilities department reported feeling a sense of doom and like things will only get worse significantly more than any other reporting group, which were all 6 outpatient clinics. Nearly 24% of these clients reported this sense of doom. Around 19% of this same group assessed from our developmental disabilities department also reported struggling more with their problems since the pandemic began, which was the second highest percentage reported. Clients assessed through our Monroe outpatient clinic reported the greatest frequency of feeling a mental health status decline, with over 22% of the clients reporting this feeling. The 3 measures of mental and behavioral health status were all intercorrelated, so clients reporting one area as affected reported the other 2 as affected as well. A subgroup of our clients who were receiving agency treatment or services for a substance use or addiction disorder was assessed to determine the effects of COVID-19. Around 12% reported that they were having a harder time handling their addiction since the pandemic began. The subgroup reported negative effects on their personal well-being, with experiencing more nervousness and anxiety, loneliness, sadness, or depression, and frustration, irritability, or anger. They also reported negative effects on their mental and behavioral health, with feeling a mental health status decline, struggling more with their problems, and feeling a sense of doom and like things will only get worse. They too had concerns about money, food, and health, as well as reports of experiencing stressed or strained relationships that were each significantly correlated with their reports of having difficulty handling their addiction. All clients assessed were asked if they had any thoughts of harming themselves or wishing they were no longer around. Around 2% agreed with having these feelings. As part of our assessment plan, any client who responded in agreement with this item was immediately transferred to a mental health professional if not already on the call with the client. There was also a follow-up provided for these clients. Significant factors affecting reports of feelings of self-harm were all 3 personal well-being items, including nervousness or anxiety, loneliness, sadness, or depression, and frustration, irritability, or anger. Also, mental health status decline, struggling more with problems, and feeling a sense of doom were significantly correlated with thoughts of self-harm. While not significant, feelings of self-harm did decrease as client age increased. In the last section of the COVID-19 Social Health Impact Assessment, we asked clients a few general questions about their access to media at home and keeping themselves informed about COVID-19, as well as their social distancing practices. Over 68% of clients reported having internet access in their household, and nearly 95% reported having access to local TV channels. There were significant differences among client race, with African Americans reporting having local TV channels more often, and Caucasians reporting having internet access more often. Nearly 78% of clients reported that they keep themselves informed about COVID-19 issues, with more African Americans reporting staying informed than any other race. Also, as household number went up, staying informed about COVID-19 issues went down. Clients from our Columbia clinic reported staying informed the least, and clients from the Developmental Disabilities Department reported staying informed about COVID-19 issues the most. There are some very interesting findings concerning internet access in the client's households. Clients who reported that they had internet access reported significantly more mental and behavioral status effects than clients without internet access. Over 18% reported a mental health status decline since COVID-19 began, compared to 8.8% of clients without internet access. Nearly 17% reported struggling more with their problems, compared to only 6.3% of clients without internet access. And over twice as many clients with internet access reported feeling a sense of doom and like things will only get worse, compared to clients with no internet access. Interestingly, even greater differences were found between clients who reported having access to local TV channels versus clients without local channel access. But here, there was an opposite association. Clients without local TV channel access reported a mental health status decline and feeling a sense of doom nearly 3 times more frequently than clients who did have access. This group of clients also reported struggling more with their problems over 3 times more frequently than clients who had local TV channel access. These findings may indicate that clients without access to local TV channels may depend on the internet to stay informed about COVID-19, which we just saw earlier may have negative effects on client mental and behavioral health status. The final assessment item on our COVID-19 Social Health Impact Assessment focused on social distancing practices. At the time our assessment was developed and implemented, the state of Louisiana was under a mandated stay-at-home order. The concept of social distancing was being introduced to society as the first line of defense against COVID-19. When clients were asked about social distancing, nearly 88% reported that they practice and encourage social distancing to the best of their ability. Male clients reported social distancing more often, and social distancing practices also increased as client age increased. Employment factors have a significant effect on reports of social distancing. Unemployed clients who are actively looking for work, as well as clients who are working outside of the home, reported social distancing less often. Clients with local TV channels reported social distancing significantly more than clients without local TV channels. There was a significant inverse relationship between social distancing practices and all 3 measures of mental and behavioral health status, where findings show that as social distancing increased, mental and behavioral health issues decreased. Finally, there were significant differences in reports of social distancing among clients employed in different industries. Practicing and encouraging social distancing was reported by 100% of our clients who reported working in healthcare, manufacturing, transportation and utilities, and non-food retail. However, among clients working in food service, only 88.9% reported this. Clients working in both the business and professional industry and the public service industry reported this less frequently at around 60% each. The lowest frequency of social distance practices and encouragement was reported by clients working in construction at 50%. So as you've seen and heard, there were a lot of significant and interesting findings in the results of this assessment. Now I'd like to give you a quick overview of some of the key findings of our social health impact assessment. Our oldest client in the age 61 and up group reported the least concerns about financials and food security, health and healthcare access, and social issues and relationships. They also reported the least negative effects of COVID-19 on their personal well-being, with the lowest reports of frustration, irritability, anger, nervousness or anxiety, and loneliness, sadness, or depression. Overall, this group reported the lowest increase in mental health status decline, lowest reports of struggling more with problems, and lowest reports of feeling a sense of doom. Again, all of these findings are really interesting, since at the beginning of reporting, this age group was the focus of most public reports on susceptibility and the dangers of COVID-19. The only assessment item that was rated highest by this age group was the concern about being unable to attend in-person church or religious services. Clients aged 51 to 60 did not report with the highest frequency on any assessment item. Clients aged 36 to 50 reported experiencing loneliness, sadness, or depression more often than any other age group. Clients aged 26 to 35 reported staying informed about COVID-19 issues less than any other adult age group, and reported feeling a sense of doom less than any other age group. Clients in our two youngest age groups reported the most negative effects of COVID-19. The 18 to 25 years age group reported experiencing more nervousness or anxiety, feeling a mental health status decline, and struggling more with their problems more frequently than any other age group. This is an interesting finding, since our assessment was completed in the early stages of the pandemic, when this age group had really not yet been identified as a key age group for contracting COVID. This has since changed. Our youngest client in the 0 to 17 years age group reported experiencing stressed or strained relationships while having to stay home, experiencing more frustration, irritability, or anger, and feeling a sense of doom more often than any other age group. Some of the things that had significant effects on assessment items included client age group, household composition, employment changes, and department or clinic location. Client gender and race had some minimal effects. Overall, although our clients were faced with employment changes and financial concerns, their primary concerns focused on the health of their loved ones first, and then their own health. The COVID-19 Social Health Impact Assessment has provided us with a wealth of information that we're using and will continue to use in order to address the specific concerns of our agency clients. Since the pandemic began, agency staff has increased the frequency of wellness checks on our agency clients in order to maintain ongoing communication and open access between mental and behavioral health professionals and our clients. The results of the assessment data analysis are being distributed to various agency departments for review in order for program and service planning to further assist clients in need. Outside of the agency, we're releasing the final data analysis report to our stakeholders and to the general public, as some of our findings may help others in our region to better understand the specific challenges being faced at this time. Finally, in October, we will be completing reassessments on the clients who completed the social health impact assessment in the spring so that we can assess for changes and ongoing concerns and effects at 6 months into the pandemic. We will prepare a similar data analysis report containing 6-month data, as well as a comparative analysis to discuss differences from the initial assessment. That's the overview of the agency client data for our COVID-19 social health impact assessment and concludes the presentation. As mentioned earlier, the full comprehensive data analysis report is available on our website, and a recording of this webinar will be posted there also. Before we move on to questions, I want to take just a moment to acknowledge and thank our agency departments, especially Developmental Disabilities Department and Clinical Services staff, who contacted our clients to complete these assessments and who also took the time, as they always do, to listen to our clients as they expressed and expanded on their concerns during this pandemic. I appreciate all of them, and I appreciate everyone who joined in today and hope that you'll join us again for future webinars from the Northeast Delta Analytics Department.
Thank you, Dr. McGee. Now we will take questions via the Zoom chat feature with the few minutes we have remaining. If we are unable to address your question today, we will follow up via an email as soon as possible. Once again, use that Zoom chat feature to enter your question while we ask the 3 submitted questions that occurred prior to today's webinar. The first question being, with school returning at this time, can you talk more about the impact of parents with children and how they're handling the pandemic as a whole?
Yes. As we saw, parents with children, regardless of marital status, had concerns of basic resources such as money for food and to pay bills, as well as for healthcare access. Our assessment did include a question that asked parents to rate their level of concern with having to help their children with schoolwork while school was closed early this spring. We only had a little over 6% who responded to that item. And as you might expect, client age group was a significant factor, as well as household composition, as those 2 items really are the ones that measured the presence of children. Single clients with children reported the most concern with that. And for all clients who responded, it was around 8% that reported helping their children with schoolwork as a concern. So it'll be really interesting to see how this item is rated when we reassess in October after school has started, specifically with the mask mandate in place.
Thank you for that, Dr. McGee. On a personal level, what piece of information throughout the entire report and findings did you find most revealing?
There were really lots of things that were interesting and surprising in these results, but I would say that the most revealing was the data concerning media, and especially the internet. Seeing that clients with internet access reported such a higher percentage of negative feelings and greater mental health status decline was really fascinating. It certainly made me wonder what platforms, types of social media, or other sites are used that could be contributing to this, or if there were other factors involved.
And we have one more pre-submitted question, and a reminder for everyone, in case you do have a question, make sure to enter it into the chat feature soon. If we do not have any questions submitted, we will end. So the third and final question that was pre-submitted was, being in the heart of the pandemic still, is an October reassessment then too soon, or is it that just right?
We feel like a 6-month reassessment is appropriate because we implemented this assessment when the COVID-19 pandemic was really in its infancy. People had only been under a stay-at-home order for a few weeks, and many of the effects probably had not been felt yet. When we are at 6 months post-assessment, we may have people who have experienced more changes and see more long-term effects of the pandemic. So we think 6 months is right about right, and we're really interested to see if there are any changes at that point.
Thank you so much, Dr. McGee. And with no other questions being submitted at this time, we would like to thank everyone for joining today. Please visit our website at www.nedeltahsa.org and follow us on our various social media handles at NEDHSA. Northeast Delta Human Services Authority, building a unified Northeast Louisiana where individuals are thriving and reaching their full human potential.